The member from Miramico-Tantramar.
Thank you, Mr. Speaker. I stand today and actually might say something similar to the member opposite, that I find myself in agreement with with both sides of the House. So there's a new era of collaboration in the air. I would like to speak. I guess I can speak to the motion and the amendment. Thank you. So I do think that the work of paramedics is very important. Obviously, it's life-saving work that they do in our communities across the province, and we need to appropriately value their work. And so their wages need to be looked at. They when we compare them to fire departments and police departments, it's not even comparable, really. They make quite a bit less than other important first responders in our communities. So I have here some numbers in front of me, a comparison of emergency responder salaries in New Brunswick. And in New Brunswick, paramedics, as of July 1st, 2018, the average annual salary, $50,000 approximately. And when we look at fire departments, the average is for different firefighters across the province as of earlier this year is closer to $81,000. So that's about $30,000 more, Mr. Speaker, and about 60% more than paramedics make. When we look at police departments across the province, their average annual salary is close to $89,000 per year. So that's a 75% more than paramedics are making. And we need to make sure that these first responders are being fairly compensated. And also ensure that the terms of their employment are fair, that they have permanent, stable jobs, that they're not on casual. And what was spoken about what was brought forward in the motion for the amendment is that wages are not the only problem faced in this labor shortage that we have. And I would agree that wages are just one part of it, an important part, obviously. We need to make sure that our paramedics are fairly compensated. And by making sure they're fairly compensated, then it certainly, I think, can help with the recruitment and the retention of these valuable workers. But there are definitely other factors contributing to this labor shortage. And included in those would be the mental health of our first responders, of our paramedics, PTSD, burnout, overwork. And it's a vicious cycle where the more that the paramedics experience and face these challenging working conditions where they're overworked and burned out, then the more likely they are to need time off work. And then we have this labor shortage again, and it makes it harder. So we need to make sure that we have enough staff, enough paramedics to staff the ambulances, in order to make sure that we are not overworking and burning out the paramedics in New Brunswick. We need to also look at how they're being deployed in the province. Look at dynamic deployment, so that we're looking at what the communities need in terms of how they should be deployed, and how it's being managed at a higher level. It would certainly be easier to pay paramedics if AMB was housed in public hands instead of giving bonuses to Medavie for their management of this system. We need to evaluate the contract with Medavie, and I think ultimately moving ambulance services under the health authorities could show an improvement in better management. Paramedics are feeling that they must work more for less pay, and that is one reason that it is difficult to recruit and retain staff. So again, I think the amendment does add that while wages are important, there are other factors that contribute to the problems paramedics face. And as I've stated, membership's burned out. There's pressure on them when their colleagues call in sick, and even when that doesn't happen, they're often unable to staff the ambulances and they sit idle. And as was mentioned, this is a major issue across our healthcare system. It's not just our paramedics where we are having trouble finding people to fill positions, and at the same time aren't always hiring. In some of these cases, we've seen this coming for years, and I'm glad that action is finally being taken, and that this appears to be an issue, one of the issues that there is collaboration so we can get something done, because our paramedics, and going beyond that, other healthcare providers have been working understaffed in a variety of areas, and we definitely need to take action, because in addition to making sure that we are taking care of our paramedics and our healthcare workers, this ultimately, the priority, I'm sure it is for them, the priority needs to be the patients and making sure that they get the appropriate care that they need. So we need to make sure that, as I said, paramedics are available on based on the community needs. And language has come up, and I want to just point out that there have been unilingual vacancies. And so I want to make sure in our discussions about paramedics that language does not become a scapegoat for mismanagement or for labor shortages, that we make sure that doesn't happen. And that we consider the option of providing paid language training for those paramedics that require and want to gain that skill. I think the transfer program recently implemented by the government is a good step, but as stated, of course, there is still a lot more work to do. We want to work together to support paramedics. They provide such life-saving, important, valuable services across the province. And so today, I guess I find myself standing to speak in favor of this motion as amended. Thank you, Mr. Speaker.